everyone, welcome to my channel. This is TRUANCY Counseling Outreach, and of course I still remain your online counselor. My name is Rachel. So today we are going to be talking of some mental disorder that affect the mindset and social lifestyle of a Gen Z child in our present day. Gen Z can be defined as the present generation. So our specialization is however going to be based on children. I am not saying this mental disorder that I'm going to be talking about does not exist among adults, but today we are going to be specializing on children. So keep tuned, and if you are yet to subscribe, please do not forget to subscribe. And if you are yet to follow us on all our social media platforms, please do follow us at TRUANCY Counseling Outreach, so that as we list those mental disorders that might affect our children, you will be able to be well informed. So today we are going to pick one out of the mental disorder. We are going to talk of truancy. But before we continue, let's first define truancy. Truancy is an action of staying away from school without any good reason. It can also be called absenteeism. Or truancy can also be defined as a situation whereby a child regularly avoids school without permission or no good reason. However, there are some words that are closely related to truancy. Number one is non-attendance. Non-attendance is when a child is expected to be in school but is found wanting, meaning the child is absent, is not in school. Number two of a word that is closely related to truancy is absenteeism. Absenteeism is also when a child is required to be in school but is not in school without good reason. Absentee can also be defined as when a child is expected to be in school but is regularly found wanting. So those are words that are closely related to truancy. However, I am going to be listing some symptoms of a truant child. So as parents, when you observe that your child is exhibiting these symptoms, or you are noticing or you are observing these symptoms in your kids or your word, please take note of them, because they can affect them in number one, poor academic performance. When a child is regularly missing school, it can come out with poor academic performance because the child is not conversant with the curricular activities of the school. Then number two of some of those symptoms is school function. When a child is absent from school, he or she is missing both curricular and extracurricular activities. That is why we say the child comes out with poor academic performance when it comes to the curricular activities. And some extracurricular activities the child might not understand because the child has been absent, or occasionally the child has been missing from school. So he or she might not understand those extracurricular activities. Number three is depressed mood. When you notice your child is always depressed, your child is always moody, please, that is a symptom of truancy. Number four is juvenile delinquency. When your child is regularly involving himself or herself in some minor crimes. Probably your child is always bullying, is always found bullying, is always found stealing, is always found selling drugs. That is another symptom as parents you should look out for. Number five of such is verbal abuse. When your child is always found abusing somebody verbally. Probably a child who is deformed, your child is always going to abuse the person, or your child is always seeing somebody with big head, big nose, small hand. That is another form or another symptoms of truancy. Another thing you should look out for is problem of socialization. When your child or your ward find it difficult to socialize effectively with normal peer group. Normal peer group in the sense that people that abstain from crime, people that abstain from problem. If your child is always in socialization with those that are always looking for trouble or always causing trouble to the school, that is a socialization problem. Your child is not socializing effectively. Another problem you should look out for as parents is bullying. When your child is always bullying another pupil or another student, that is another symptom of truancy. Another symptom you should look out for is self-perception. When you notice your child is faced with low self-esteem, some children do not exhibit that fear or that symptoms of low self-esteem, but instead of exhibiting it that they have low self-esteem, they go or they change it into defensive mechanism, meaning they are always stubborn, they are always looking for trouble, always beating up somebody. That's a defensive mechanism of low self-esteem, because there are some times that all they need to do with their peer, that's why I said it's part of socialization problem, it's just conversation, but because they have low self-esteem, they believe in bullying, in beating somebody. So truancy also affects your child's self-esteem. That is why it affects your child's social life, and it affects his or her mindset. That is why I said some conditions that affect the Gen Z's mindset and social lifestyle. Here are some behaviors of a truant child. Any child that is faced with truancy, here are some behaviors that they exhibit. Number 1, defense mechanism. That's antisocial behaviors. In order to cover up their low self-esteem, they come up with antisocial behaviors. Antisocial behaviors means behaviors that are not socially acceptable, behaviors that the society do not accept, meaning as an adult, once you exhibit antisocial behaviors, it can lead you into police detention. So have destructive behavior. That's once your child is constantly involved in trouble, fight, and your child becomes a vandal. One of the behaviors your child or a truant child exhibits is persistent disobedience. When your child is always disobeying rules and regulations, the child is finding it difficult to adhere strictly to rules and regulations. Already the child is finding it hard to adhere strictly to the school rules. That's why the child is abstaining from school, and it cuts across the child's general lifestyle, his social lifestyle, meaning there are some rules you lay down in the house. You say don't touch it, nobody should go there, the child would definitely disobey. That is persistent disobedience. We also have frequent lying. The child tends to start lying. When you notice your child lies a lot, that is another sign or another behavior of a truant child. We also have aggressive behavior. The child is always aggressive. There are some logical conversation you'll be having with your children, but you notice, okay, out of my kids, this is the most aggressive child. Please take note of that. The child might be faced with truancy, which is also a mental disorder. Another behavior is minor form of theft. The child is always stealing, always picking something that doesn't belong to he or she. You find out that the child is always picking it up. Here are some risks that a truant child is faced with, or some dangers truant childs are faced with. Number 1 is academic failure. The child doesn't perform academically well because the child is missing or is not conversant with the curricular activities. And number 2 is social isolation. People that socialize normally would not want to have anything to do with a child who has antisocial behavior. So the child is socially abstinent or socially isolated from normal peer group or normal peer socialization. We also have substance abuse. Such children tend to start abusing substance like smoking, drinking, and some of them go as far as even selling those substances. Number 4 of some of the risks a truant child is faced with is low self-esteem. That's why they lead to bullying and aggressive behavior. So once you notice your child is always a bully, you have thought people have punished the child, the school has even deported the child, and sometimes the child has been expelled from a particular school, that is a symptom of low self-esteem. Another risk a truant child is faced with is unwanted pregnancy. because the child doesn't stay in school, is always avoiding, or she is always avoiding school, she is at risk of getting pregnant. Number 7 of some of the risks a truant child is faced with is criminal tendency. As the child develops, the child tends to become a criminal. Just as we said the child, some of the symptoms is minor theft and bullying. So once it is not properly managed, the child advance or develop into a criminal. Number 8 of one of the risks a truant child is faced with is harmful social and financial consequences. Social in the sense that the child socializes with the wrong set of people, and at some point they start to exhibit antisocial behavior. Financial consequences is 1. The child starts to steal. 2. The child starts to waste money the child starts to waste money on some substance which has to do with drugs, alcoholic substance, and so on. So when it comes to financial stand, they start becoming wasteful. The risk factor of a truant child. We have several risk factors, and each of those risk factors have little kids under them. So the A part of this risk factor is school related. However, I'm going to be listing the numbers under the A part, which is school related. Number 1 of it is conflict between home/school culture, meaning once the child leaves the house, he finds it difficult to understand why he should go to school. So it's having conflicts, or is faced with the conflicts of home and school. 2, under school related is ineffective discipline system. Some schools don't know how to effectively punish any child that goes against their school rules and regulations, or that regularly abstain from school. Sometimes you just see the school, they just expel the child. That means you are chasing the child from your school to another school to continue with that behavior. That is why we always advise every school to have a counselor, so that counselors can help modify such children. And if there's a need to discipline the child, you can also adopt B.F. Skinner's theory of reward and punishment. Number 3 of what parents should take note of under this school related is negative school climate. That is the proximity between your home and the school. Sometimes the distance between your home and the school is extremely far. So once the child looks at the distance, the child might just deviate from going to school, or the zeal for the child to want to go to school is discouraging. And if you notice that the proximity is not close, it's wide, you can get means of transportation that will help or facilitate or encourage or motivate the child to want to go to school. Number 4 of some of the school related risk factor is lack of relevant curricular or extracurricular activities. Curricular activities in the sense that during the regular fixing of the school timetable, you can also put in guidance and counseling as a course. Although some schools don't even have counselors, so how are you going to put in guidance and counseling as a subject? It's supposed to be so. You are supposed to put guidance and counseling as a subject. And when it comes to extracurricular activities, when you are creating clubs, you can also create awareness club where the kids get enlightened, where they get taught the morals, the norms of all the expected social behaviors. Sixth factor of school related is inappropriate use of technology. Some schools have cameras or CCTV cameras, but they don't make use of them. Or once they make use of them, they don't even see things that they are supposed to see, like the case of bullying, like the case of substance abuses. Those cameras, that's the work of those cameras, for you to fish out students who are faced with antisocial behavior. Regard for student/pupil learning style. Everybody, we all learn in different form, or we have different individuality. We are different. We cannot learn at the same pace. We cannot learn at the same time. Some people are fast learners, some people learn at average, and some people are slow learners. So some schools just disregard the learning styles of some children. Sometimes schools should try to adapt different methods of teachings to help those kids, that especially those that are slow. And if you notice you are not a special school and you have special needs kids, please advise the parents to take them to special schools, especially these days when we have private schools that don't want to tell parents the truth. Once you notice that this child is a special child and you know you cannot parallelly educate or tutor that child, please let the parents get involved. Let them know. Let them be aware of what is happening. Don't just put them in the dark. If you are another risk factor under school related is retention/suspension. That's why I, as an individual, I don't encourage suspension and I don't encourage the burden of retention, because some children intentionally, especially a truant child, intentionally misbehave. Somebody that doesn't like school before, then the child now intentionally misbehaves so that the school can suspend he or she. That means that's an upper edge. So if as a school you notice a child is faced with truant disorder, please look for another means of punishing the child with the involvement of their parents or their guardians. Don't always expel or suspend the child, especially expulsion. When you expel a child, you don't modify the child's behavior. You only push the child's problem to the hands of the parent, while the parent on the other hand pushes the responsibility to another school. Under school related is school/teachers understanding to know a child's change in attitude. Some teachers are not observant, maybe because they are not being paid well, or probably their salary did not come on time, or they are angry from home. I don't know. Some teachers do not observe when a child's attitude changes. That is, a child that is vibrant before all of a sudden becomes a truant child, and you just did not observe that there's a change in attitude, that there's a problem somewhere. The school should be able to, or the teachers should be able to understand that a child has changed in behavior or attitude. So it is the work of the school or the work of the teachers to understand that, okay, a particular child's attitude has changed. Another risk factor under school related is lack of language instruction. That is, there are some children that communicate in a non-verbal way. I always talk about this in my videos. So as parents, as teachers, you should be able to understand your word or your child's non-verbal communication. There are some children that will not come out to explain, especially a child who is faced with molestation. Some of them are being threatened by the people that molested them. They won't come out. Another risk factor of truancy is the B part is student related. So under the B part, we have other kids. One is poor school attitude. The child doesn't want to go to school. Is not willing to go to school. Number 2 is slow adaptation to new environment. The child finds it difficult to adapt to new school environment or new environment in totality. Number 3 is antisocial behavior. That's involvement in minor crimes. And number 4 is poor socialization or poor peer socialization. The child finds it difficult, or the student or the pupil find it difficult to socialize effectively with people with normal social behavior. The child is always seen socializing with people with antisocial behaviors. Self-esteem or self-inefficiency. The child is faced with low self-esteem. At the end of the day, he comes up with defense mechanism or disobedient or minor theft attitude. That is to cover up for his low or low self-esteem. Another number you should look out for is non-participation to school activities, whether curricular or extracurricular activity. The child is less concerned. Another risk factor is community related. Community related, if not properly managed, can affect the child as an adult. Number 1 is lack of support for community/immediate environment support service or response. When a truant child is not properly managed, when the child becomes an adult, when the community is getting involved in something, or they are donating for something to promote the community, or they are coming together to discuss something that promotes the community, you see the child lacking there. The child is less concerned about it. Still related, we have lack of community/immediate environment support for schools. You see, that's why I said this community related. if not properly managed, it can affect the adult. So it's a risk factor that affects a child to becoming an adult. You see some ex-students trying to help a particular school or build up a particular school, and you are trying to put heads weight together, and you find out that there's this particular adult that is less concerned in all what people are doing, and let's build this school. The adult is, I'm less concerned. Is showing a lackadaisical attitude. So under community related, we have tendency of criminal activities. However, risk factors are those things that put you at risk of becoming a truant individual. You notice that as a child, your child is faced with minor crimes like stealing, bullying. You don't effectively manage it, or you don't treat that mental disorder of truancy. It can affect the child's behavior in future. Lack of school/community linkage. When you see that an adult cannot link up with his former schoolmates or cannot link up with some people in his community, it started as a child, which was not treated. That's why it led to affecting the child from being able to link up with his former schoolmate. Another risk factor is family related. That's another risk factor. So under family related, we have other numbers. Number 1 is low SOS. SOS is social economic status. So you see some children or in some family, it is believed that making money is more important than being educated. So they prioritize making money than going to school. So such children that comes from that family might develop or have the attitude of being a truant, because they place more value on cash than knowledge. Number 2 is dysfunctional home. An home where it is being dysfunctional. Parents have low expectations for the children. Low or no expectations. So parents don't even expect anything from the children. They don't expect them to abide by rules and regulations. Some dysfunctional homes can lead to can be as a cause of divorce, can be as a cause of busy parents. So part of it falls under parenting styles. Anyway, I talked about parenting styles in one of my videos. So once you have a dysfunctional home, the child you might not even know as a parent that your child is a truant child. Then we also have no or low communication at home. Sometimes there should be at least a day in a week where you gather together as family to talk about your day-to-day activities or what has happened the last few days you communicated. But if there's no communication or there's low communication between the parents and the kids, the parents might not even know that the child is faced with truancy. We also have high mobility, whereby a child is free to move freely. Nobody is questioning the child's movement. Nobody is saying, where are you heading to? Where have you been? The child is free. The parents are less concerned about the child's well-being. We also have mental disorder related. This risk factor is classified under mental disorder related. Number 1 is clinical depression. This is characterized under persistent depressed mood and non-interest in activities. Once the child is less interested in some activities that the child is used to, or otherwise the child is constantly or occasionally depressed, that is a clinical depression. That's another risk factor under mental disorder related is anxiety disorder. This is characterized by fear and worry. When a child is always fearful, always worrisome, the child is at risk of being a truant child. Number 3 under mental disorder related is bipolar disorder. That's episodes of mood swing. Constantly the person is having mood swing. This meaning the person is happy, this meaning the person is sad. Another risk factor under mental disorder related is also known as dementia. That is characterized by forgetfulness. Once you notice that somebody or a child is always forgetting something, the child is at risk of being a truant child. This factor is post-traumatic experience. That is characterized by failure to forget a terrifying experience or to recover from a terrifying experience. For instance, a child while growing up witness an armed robbery scene, the child might find it difficult to forget, and that can affect the child's mental well-being. And the topic we're going to be talking about is people who can diagnose that your child is faced with truancy. Number 1, health worker. An health worker who is known as a psychiatric doctor can help diagnose that this child is faced with truancy. Number 2 is a psychologist or a counselor. Those are the people that can diagnose that your word or your child is faced with truancy. However, there is treatment to truancy. So let's talk about the treatment of truancy. Treatment of truancy. After being diagnosed by a psychiatrist that your ward or your child is faced with truancy, the child or the ward is going to be referred to a therapist, which a therapist can also be known as a psychologist or a counselor. They are going to help with the use of rational emotive therapy by Albert Ellis to help the child with the following. I am going to list them. I am not going to explain them, so that you don't try to treat yourself. So once you notice your child is faced with truancy, please report for medical help or see your psychologist or your counselor. So let me list them. Number 1, modeling. Number 2, cognitive restructuring. Number 3, behavioral modifications / therapy. And the last but not the least is reinforcement. That's both positively and negatively. However, it is the work of your counselor or your psychologist to help with the treatment. You are not to treat yourself. So once you notice your child is faced with truancy, please seek help. And if you are not sure if your child is faced with truancy, please seek help. If you have any addition as a parent whose child is suffering from truancy, please do not forget to comment below. And if you have any questions, please don't forget to put your comments below. And if you are yet to subscribe to this channel, please don't forget to subscribe. And if you are yet to follow us on our social media platform, we are at Royal Care Counseling Outreach. Don't forget to follow us, and don't forget to like our page. Your like is very essential to us. I still remain Royal Care Counseling Outreach, and my name is Rachel. Bye bye.